Welcome to the Future of Community Health Needs Assessments, where we will dive into how hospitals are transforming community health data into strategic assets to fuel smarter decisions across departments. I'm your host, Angie Grover, co founder and Chief Operating Officer for Metopio, and we are proud to partner with the American Hospital Association to feature hospital leaders who are using technology and fresh thinking to elevate how community insights drive impact, collaboration, measure change, and align the enterprise. Let's get started with our feature leader today. Nicole Edmonds is the Director of Community Benefit for Baylor Scott and White Health, which is the largest not-for-profit health system in Texas and one of the country's largest. Nicole's deep commitment to working with communities makes her an effective partner and leader in this work. At Baylor Scott and White Health, she leads the community health team and collaborates with executives across the vast integrated health system. I'll also just note that she lends her expertise in the classroom by teaching the next generation of health leaders at DePaul University. Welcome, Nicole. We're so glad to have you today.
Thank you. It's great to be here.
So, we're coming together to talk about the innovation you're leading at Baylor Scott and White Health. And we've been doing this community health work together for a while. So, I'm very interested if you can reflect really on the evolution of this process from when you first started doing CHNAs to kind of where you sit now at Baylor Scott and White Health.
Sure. So this really started as a regulatory process, but those of us focused on community health have always been taking the social determinant of health into consideration, and really viewing this process as an opportunity to understand the needs and disparities, so we can better address health issues and improve overall health outcomes. This really started off as a very labor intensive process, which largely focused on secondary data analysis, because it took so much time. Many health systems were reliant on consultants that held and collected the data, which made it very static and siloed from the organization, resulting in a report focused on compliance versus a report that can be leveraged and is functional to support the larger strategies and goals of the organization. So today we've really shifted in terms of how we look at and utilize our CHNAs. Payment models have shifted to more focus on root causes and poor health outcomes. And we've taken the community health needs assessments and really aimed to integrate them into the larger decision-making process of our organization. By using tools like Metopio that put data at our fingertips and really speed up our analysis, we have more time to engage the community, collaborate, and focus on strategies and partnerships to really address those key health needs that are identified within the CHNA. This last cycle, we produced a report in partnership with Metopio that really provided an in-depth understanding of the demographics, socioeconomic makeup, and the health and social needs of the communities that we serve. And because this report was so robust with data, we've been able to share the data and the report across the organization as a valuable strategic asset.
And I think for folks who have been doing this work for a long time, that's long overdue. We know that these are root causes and drivers, and the more that we can elevate those in the system. So, while it's true that the continued focus on quality and improving health outcomes is not the only driver of the CHNA evolution, it's also a catalyst for collaboration both internally and externally. So I know in your role at Baylor Scott and White Health, one of your goals was really to provide these valuable insights to a broader audience. So, can you talk a little bit about how you're doing that today?
Sure. So at Baylor Scott and White Health, we've engaged several departments and entities in the CHNA process, including our community survey that we completed as a part of the CHNA process, where we invited all of our Baylor Scott and White Health team members and employees to participate, since they are, of course, a part of our CHNA community. We also worked with Baylor Scott and White Health Plan, which has a very robust community outreach strategy. We were able to share data insights with them to help inform their strategies. They even used a lot of the Metopio data to dive deeper into specific health issues, such as access to care and maternal and child health. In addition, we've worked with our health disparity and impact committees across the system to share Metopio insights and data around health disparities within their primary service areas so that they can develop data-informed strategies on addressing patient disparities and provide resources to address those disparities. Also, we've used our CHNA and Metopio data to cross compare it to our patient and customer health needs and pain points. This is crucial because we really want to understand the differences, if there are any, between population health needs and our customers' needs, and really leverage our enterprise resources and services and products where those needs align. Finally, we've also leveraged Metopio data through building out a CHNA data dashboard. This is full of data that is available to external and internal partners so that they can also have the data at their fingertips to better understand the needs of their communities and develop data-informed strategies that really aim to improve programs and the overall health outcomes of their communities.
And Nicole, I'm going to throw one at you really quick because I think part of the work that you did there too was to create a framework and really align how all of your CHNAs were being conducted, right? So you had that enterprise view. Were you able to at least take a framework to each of those areas that you did a needs assessment? And so now you can kind of look at how that's working from hospital to hospital?
Yeah, so we've actually shared our CHNA and the framework with each of our hospitals. So I'll just give you a little bit of background for those of you who are not as familiar with Baylor Scott and White Health and how we are structured. Our CHNAs cover 52 of our hospitals and our joint venture facilities. And so we have a very large footprint that we are covering with several hospitals. And so we have taken that framework that we conducted that we utilize for our CHNA to each of our hospitals and our joint ventures so that our leaders understand how we conducted our CHNA and can utilize that data across their hospitals and across their joint ventures, and really be able to articulate and present the details around the CHNA to our community partners and some of our community leaders as well.
Yeah, I think, at the bottom of the slide, it says the CHA isn't the end. It really isn't. It's the start of a broader conversation. And of course, the work that goes along with the chip. But you've hit on one of my favorite topics, and you mentioned that a little bit, technology. And at Metopia, we've really been focused on a purpose-built platform that has data and tools for leaders like you to bring that community context into the decision-making process. So when you think about how technology has impacted your work, from when you started to now, I mean, the possibilities are endless. But what would you say are kind of your top 5 ways that technology has helped you?
Sure. So number one, I'd say we don't have to rely on static reports because we have that data. Second, we can easily create powerful geographic insights for the report and one-off request, which we've really actually done a lot with Baylor Scott and White Health, especially with departments and leadership teams looking to understand and address health disparities. Again, we've worked with our quality teams, our quality leaders, we've worked with our community impact committees and health equity committees. And so they really like to hone in on specific communities. And so to have that data at our fingertips where we're able to not just collect that data, but also analyze it to make data informed decisions, that's been phenomenal. We've also been able to leverage new data sets like Texas claims data and survey data at the population or community health level. I'd also say technology has really allowed us to bring quantitative and qualitative data together in one place, which has been fantastic and really makes it easier to access qualitative data and also cross compare the qualitative data with the quantitative secondary data. And then finally, I'd say that the technology has enabled us to really share the data and insights with internal and external stakeholders and leaders, not just once every 3 years, but an ongoing basis.
Yeah, and you've hit on a couple things. I always say, when you can have that utilization data, that survey data up against the community context, that's really where the magic happens. Because, typically when we work on these things together, we're looking at the 36 preventable hospitalizations from AHRQ, which are largely driven by chronic disease, right? Uncontrolled chronic disease. So when you can see that and then look at what some of those root causes are, as well as just really easily integrating that lived experience to make sure that secondary data is telling you the truth. I think it's
Mhm.
really powerful, and having that at your fingertips as well as your teams makes your work really really robust.
Absolutely.
So we were just going to take a quick look at how that actually works. And so we are looking at that quantitative part. So one of the things that we have done in working with CHNAs and Baylor Scott and White Health is go into the community, do the work that you need to do, focus groups, key informant interviews, and we've pulled it together into the platform so that you can do an assessment of how what your community is saying aligns with that framework that Nicole was referencing. So if you have your key themes, then you can bring those pull quotes and really analyze the secondary indicators next to that qualitative data. And I think that's what the MAP 2.0 and other processes are really challenging us to do, is get beyond that secondary data, because that is really the table stakes to bring the lived experience into the process. So as you think about where you're going to use all the information you've collected, and you've touched on this a little bit, and you've analyzed it over the course of your community needs assessment, what are the places that you think are going to be most valuable either now or in the future? And have you already seen an impact?
Yeah, well, the CHNA brings community context to population health, to target interventions, and really, the CHNA is a report that drives our community outreach and affairs strategies. So we are intentional about who we partner with, and what events or programs we engage in, versus I think traditionally, we've just kind of engaged in various health fairs if we were requested to attend or support. I think again, bringing in that CHNA to provide almost a strategic roadmap for who our partners are, what activities we engage in, and how we engage with our community partners in those activities. The CHNA also demonstrates potential areas for strategic growth, and the CHNAs have also helped us map disparities that can inform initiatives to improve quality and address disparities. This is a big one, and outside of our community affairs teams, and outreach teams, the quality leaders and departments across the Baylor Scott and White Health system have really been the group that utilizes CHNA reports the most. And really, our quality teams, they look to address issues that kind of revolve around health disparities and health equity. And many times that data is just not available at the patient level. And so they've really been able to utilize and leverage data that are within our CHNA reports.
Yeah, I think that's really important. And the fact that you can get it whenever they have a request is super helpful. And I know that, you've been able to dig into some of these communities. Do you want to talk a little bit about what that looks like?
Sure. So I mentioned in the earlier slides that Metopio has really enabled us to have data at our fingertips. We've worked with Metopio to pull several insights and create data reports requested by our health disparity, our impact committees, our health equity committees and leaders, who again, they look to address issues like health disparities or gaps in access to care. Many of our health impact and health equity committees focus on, again, health disparities within the patient population. And I just talked about this in the previous slide, so I won't provide too much detail. But again, a lot of data that they need to understand those health disparities that are present within our hospitals, within the patient setting, it's just not available. And so Metopio has been a phenomenal partner and a resource to really pull in that population health data so that we can understand from a population health level or community context where health disparities exist in our most affected and vulnerable populations within the communities that we serve, so that our impact, our health impact and health equity committees are more data driven in their approach to address those issues within the hospital setting and within the larger community setting.
Well, and that could be not just one variable, right? It could be, if you're looking at maternal health, it could be, prenatal nutrition, or, you know, uh, mental health or support services post delivery, or I know we had talked about low birth weight. So like there's a bunch of different variables that come into play that could be valuable, in any program that you're looking at. So it's really exciting to see how Baylor Scott White Health is really leading in terms of making sure that this data is available to everybody who needs it to make decisions and to serve the communities in a really meaningful way. So, if people want to follow your lead, Nicole, what should they be thinking about?
Great question. So number one, make CHNA data visible beyond community health teams or community benefit teams. And I'd add to that by just saying that in addition to making the CHNA data visible really talking about how and why the CHNA data should be utilized, because many of our clinical leaders and teams don't necessarily connect the dots with their work and the CHNA, and how the data within the CHNA can really be used to enhance their work. The second takeaway is really around investing in technology that makes data accessible and insight sharing easy, so that you always have the most up-to-date data at your fingertips to support internal and external efforts. And then the third takeaway that I'll share is really just including team members and employees in your assessment, because they are part of our communities, part of the communities that we serve, and have valuable insight as to what the needs are of those communities and the gaps in healthcare.
Yeah, I think that is really good advice. And I think anybody, whether they're working at an individual hospital or at a larger system, can really look across and use that advice to elevate what the work that they're completing when they're completing their community health needs assessment. So, most hospitals have data on who walks through the doors. I mean, we talked a lot about this, but they lack that context for what brought them there, right? Or maybe they're not even seeing who's showing up. I think you made that point early on. We can look at our patients against what that community looks like. And is it reflective of the community, or are we serving a subpopulation of the community? And I think really today, Nicole has shown us how important that community context is, and how you can take the work you're doing with your community health needs assessment and partner both with those internal departments like quality or community engagement and external organizations to improve health outcomes in the communities that you serve. So I just want to say thanks for joining us today, Nicole. It's always such a pleasure to talk with you. If today's conversation has sparked new ideas or given you a fresh perspective on community health data, we'd love for you to share it with your colleagues or access the recording and assets we have made available for the American Hospital Association members by scanning the QR code here. Again,